Welcome to the Learning Pines YouTube. We hope this video helps.
You start by removing contacts and washing your hands. This prevents irritation. Once done, apply a cool compress for 5 to 10 minutes to constrict vessels and reduce swelling. Next, instill preservative-free lubricating drops 1 to 2 times to re-wet the ocular surface, which improves comfort and reduces redness. While the compress works, sit upright, breathe slowly, and avoid screens so the eyes can begin recovering naturally. These first steps address immediate discomfort and set you up for deeper recovery. You continue by massaging the eyelids gently for 10 to 15 seconds toward the lash margin to express clogged glands and improve oil flow. This helps stabilize your tear film. Then perform blink exercises, 10 deliberate blinks every 5 minutes, to spread tears evenly and clear debris. Make environmental tweaks. Lower screen brightness, increase ambient lighting by about 20 to 30%, and enlarge text to reduce squinting. These steps restore tear quality and reduce strain, addressing the more complex middle phase of recovery. You finish by taking a brief 20-minute nap if you can. It resets alertness without grogginess and lets the eyes rest. Make a night routine. Consistent bedtime, avoid screens for 60 minutes before sleep, and consider blue light filters to prevent recurrence. If you experience worsening pain, blurred vision, or sustained redness beyond 48 hours, contact a clinician. Troubleshooting tip: if drops sting or irritation increases, stop use and rinse with saline. Persistent symptoms need professional evaluation to rule out infection.
Thanks for watching. Consider subscribing if we helped you.